We all develop back pain at some point in our lives, right? Back pain is so common that most of the times we just pop a pill, we just take rest, we just do some hot water bag, some Volini gel to the back, and then that gets settled over a period of 1 or 2 days. In fact, most of the times it is true, but there are some cases where back pain can be disabling. They can mean there is something more serious going on underneath or inside your spine. And these are the cases that should not be neglected in consideration of the majority, where many of the back pains reduce over a period of 2 to 3 days. My name is Dr. Umesh Srikantha. I am working as a neurospine surgeon in Bangalore, and in this video I'm going to tell you about the serious signs or symptoms that you should not neglect when you have back pain, and immediately consult a doctor or get investigated as what might be the cause of your back pain. Now, there are so many cases where back pain starts off as a mild back pain. It gradually increases over a period of time, but you have to understand that if the back pain proceeds or prolongs for more than 6 weeks due to any cause, whether it is on and off, whether it is mild to moderate, whether it is only intermittent, if it is there for more than 6 weeks, it is always better to check why this is happening and get it sorted out. Now, any sudden severe back pain, usually we attribute it to muscle spasm, right? Muscle strain. And that is something that should not be neglected if that sudden severe back pain lasts for more than 3 to 4 days. If you are not able to get up and walk to the bathroom even after 3 to 4 days, again, it is something that should not be neglected. Mild to moderate pain. I started off as a severe pain. Initial 2 days, I was not able to get up at all. And then after that, it is the small continuing type of pain, which has been persistent for now more than 2 weeks. Initially, it was very severe, but I improved. So because it has improved, I can neglect it. That is not true. Again, something that could start off as serious and continue in a small, innocuous way for more than 2 weeks. Again, it should not be neglected. You should take care. Now, sudden severe pain, again, which lasts for more than 3 to 4 days, you should not neglect. Apart from this, if there are any associated symptoms, like say for example, if you have pain that is coming down your leg rather than just the back pain, people usually call it as sciatica. And this is something again that should not be neglected. It is better to get it sorted out if sciatica persists again for a long period of time. Now, there are some serious warning signs. What are these warning signs? If there is a numbness, that is loss of sensation. If there is a weakness in the leg, you are not able to move your big toe, you are not able to move your foot. When you are walking, you feel a little wobbly, your balance is not right, your slipper is slipping off from your foot, you are not able to seal the hot and cold water in your feet. So these kind of loss of sensation or weakness indicate that the nerve is getting weak or nerve is getting damaged, and you should always not neglect that and immediately get investigated. Sometimes there can be loss of bowel or bladder function. Person may have difficulty in passing urine or passing stools, which usually happen in the last stages, which usually happens in terminals. But if that happens even early in the course of the disease, again, it should not be neglected, and these are considered emergencies where it should be investigated and treated at as early as possible to enable faster nerve recovery. If it is delayed for a long period of time, the nerve may get irreversibly damaged, and that can cause permanent neurological problems for the rest of your life. So that is something that we should not neglect at all. Now, there are some other cases where back pain should not be neglected. People who develop back pain when they are more than 60 years of age, because there can be a lot of other things that are going on in them. So again, persistent back pain for more than 60 years. People who develop back pain with a history, who have a history of prior cancer, who have a history of using immunosuppressant drug, who develop back pain after a fall. It could mean that there could be an injury or trauma or a fracture that has happened in the spine. Though it may be initial to start with, again, if it persists for a long time, it should not be neglected. People who are using steroids, people who are known osteoporotics. Osteoporosis means weakness in the bones per se. So in those cases, again, back pains that last for more than a few days should not be neglected. So overall, these are the factors in which back pain should not be neglected, which includes long, disabling or intermittently worsening back pain, pain that radiates to the legs, pain that actually associated with numbness, associated with some other factors that I've already mentioned in the video. So these are the factors which should not be neglected. So to summarize, so whenever there is a back pain, most of the times you can take home-based remedies, but there are some instances where back pain should not be neglected. You should consult a doctor as early as possible if these warning signs that are mentioned in this video are present.